So thank you, Aeliya, for joining me today. I know we were going to do an Instagram live, but I appreciate you pivoting to doing a recording of our talk today. As you know, and as everybody knows, October is a month dedicated towards raising awareness about breast cancer. It's a month dedicated towards raising awareness, promoting education about what it really is, the disease, and surviving breast cancer, as well as fundraising for this disease. And so part of what I do is I like to hear from women who have gone through the experience of breast cancer, and I like to share these stories, really because I feel like a lot of us have gone through fears. There's a lot of stereotypes about breast cancer. There's a lot of shame and stigma towards opening up about this disease. And so really the purpose is today is just to hear from you of what going through breast cancer really was like for you, how you navigated it during and after your treatment. And so I really appreciate you, Aeliya, coming out and to sharing your experience today.
Thank you so much, Shalina. It's an honor for me to be able to speak to you again. You know, and a lot of people know that you are an integral part of my healing. And the work that you're doing is extremely important. And like you said, I think one of the goals is to reduce that stigma and that taboo around talking about this topic, especially as a hijab wearing Muslimah. I think
Absolutely.
especially in our space,
Yes.
it's even more important. So this is a really big honor for me. And I thank Allah subhanahu wa ta'ala for this day that both of
Yes.
us have survived and we're here and we're able
Alhamdulillah.
to do this.
Alhamdulillah, absolutely. And I love how you bring in God to it because it is a privilege, it is an honor, and it's only with His grace. So Alhamdulillah. So I'm going to introduce you briefly, and then I'm going to ask you to share a little bit about yourself. I met you about 3 years ago. I actually looked it up, and it was actually 3 years ago exact that we met. And I just got a strong impression of you of how, first of all, I so appreciated your honesty and your vulnerability in our first conversations. And secondly, I just got a sense of your strong sense of belief in your passion about two things, about your faith and about your family. That came across to me so clearly and so beautifully that I was taken by it. And you have also a very positive, contagious energy and a sense of hope about you that I really gravitated towards. So I really appreciate you coming in. By background, Ailey is a mother, she's a wife, she's a daughter, she's a sister, and she's also a trained pharmacist. But for the purposes of here, I'd like you to start off by telling me a little bit about how you were diagnosed with breast cancer.
Yeah, I did find the lump myself. I had my third baby back in March of 2020, and around February 2021, I discovered a lump and I let my OBGYN know about it and was seen within about a week of the discovery. But she dismissed it and thought that it was related to weaning the baby and told me that, if it persists, to let her know after a couple of months. So that was also at the time that the COVID vaccine had just come out. So what they were seeing in women was that a lot of women were having lymph node swelling as a result of the vaccine.
Okay.
So I don't remember if I'd had my vaccine by then, but she said once you get your second vaccine, then after that, then, because it's showing some false positives upon
Right.
ultrasound. But
Right.
really looking back, I wish she had just said, okay, we'll just skip all of that and do a mammogram. But the reason that
Right.
wasn't indicated was because I was 36. So
Yeah.
I had never had a mammogram. So that,
Right.
ended up being like I followed up in April,
Mhm.
and then she looked at it again, and she was like, "Okay, let's order a mammogram." But they didn't order it stat; they ordered it for May, and so I
Yeah.
had an initial set of mammograms, and then they told me will need, one biopsy. But once I went in for the biopsy, they did a contrast induced mammogram because contrast, is what lights up the cancer. And unfortunately,
Right.
they found cancer in
Mm.
both sides. And so I actually ended up
Yeah.
having two biopsies in the same day and got diagnosed about a week after that. So it really took by the end of May for me to get diagnosed, even though I
Right.
found the lump in February.
Yeah. So like a good 4 months, for almost
Oh,
four
yeah.
months to.
Yeah. Hmm.
Yeah. And what were your feelings and thoughts during this time? because it's almost like you brought up what you noticed, you were kind of dismissed, and the doctors seemed to think it was not related to cancer or anything suspicious. And then you having to go through noticing and waiting for more tests. What was that like for you?
The interesting thing was because it was still COVID and the kids were
Yes.
home and they weren't going
Yes.
to school in person, I was really overwhelmed by that by itself. So
Yes.
to be told by a doctor who was a very good obstetrician, she did an excellent
Right.
job with my third
Right.
pregnancy and the delivery.
Yes.
So to be dismissed by her actually felt like a relief. To be told
Right.
that
Yeah.
you don't need to worry about this, it's
Yes.
not a big deal. You're
Yes.
so young, you're
Okay.
healthy.
Right.
I actually felt like, okay, that's one less thing to worry about at this
Got
time.
it. Mhm.
But then later on, when I advocated, for myself, and I said, no, like this is not going away, and unfortunately, there are
Mhm.
more symptoms presenting now, like
Mhm.
a change in appearance, right? So just from the
Mhm.
surface, I was like, okay, that's problematic, and I would rather know sooner than later because
Mhm.
now if it
Mhm.
is genuinely
Right.
cancer, like we need to get this treated
Yes.
right away.
Right. Yeah. And so I think it's wonderful that you brought up the point that you did reach a point where you did have to advocate for yourself. Because I think this is very common when I speak to women is the need to advocate for yourself and what you're noticing, even if you don't fit the criteria of being 36, not really requiring a mammogram, advocating for yourself and not being discouraged when they don't hear you the first time.
I completely agree. She
Mm.
also tried to almost like it is like medical gaslighting because I had
Mm.
postpartum depression and anxiety after my third
Right.
baby, and that was
Right.
new. I didn't have
Yes.
that with the first two, so she
Right.
actually chalked it up to
Right.
anxiety, and she
Right.
wanted to dismiss it while then blaming the anxiety, and
Right.
that's medically inappropriate.
Right.
And you know that as an occupational
Yes.
therapist, I know that as a
Yes.
pharmacist, you're not
Right.
allowed to extrapolate data where it doesn't connect, and one thing
Absolutely.
does not define another, right? Just like now,
Yes.
I know we're going to
Yes.
talk about it today, but like recurrence anxiety, that
Yeah.
doesn't necessarily mean that because you're anxious that you're not
Right.
discovering new symptoms or that they don't need follow-up, right?
Right.
All symptoms need
Absolutely.
to be treated independently of each other,
Yes.
especially in
Yes.
oncology.
Right. Absolutely. So then what happened? So you got this diagnosis. It was during COVID. So I believe you went through these biopsies by yourself.
Yeah, I did. My husband
Yeah.
could bring me up to the building and then he had to sit in the car.
Yeah.
And he actually at one point had message saying like it's taking a long time. And that's because he didn't know that they were doing both sides at the same time.
Yes. Yeah.
So I think, that isolation at that time, as well as during the other exams and treatments, really made
Right.
me very, very dependent on Allah subhanahu wa ta'ala and on
Mm.
our Ahlul Bayt, the family of
Yes.
the Prophet.
Yes.
When you're kind of left on your own, and I give a lot of credit to the healthcare providers. They did a lot
Yes.
to be very supportive. There was a lot of
Right.
hand holding and a lot of
Right.
compassion, right?
Right.
A lot more hugs than I think there would have been otherwise because they knew they were the only other humans
Wow.
in the
Oh,
room that could
yes.
offer that. And they
Yes.
did. They
Yeah.
showed up at every single place.
Right.
And I'm really, really grateful for that. But at the same time, there were a lot of moments where I felt like I was just alone with my thoughts,
Right.
and that
Yes.
made me turn toward God in a way that I wouldn't have otherwise.
Yes.
So once I got diagnosed, it took about 3 weeks for me to get into MD Anderson. It took some time and some
Right.
referrals.
Right.
Once I got in, they were really concerned because the size of my tumor was huge. I
Right.
was
And
told
sorry to
by
interrupt, because you're in Texas, MD Anderson is a very prestigious cancer center there. Is that correct?
It is. It's literally like 30 minutes from our house. And
Okay.
so I was really fortunate. Actually, when I went, they were asking patients because of COVID, like, have you traveled in the last 2 weeks? And
Right.
I was thinking,
Yeah.
like, who travels, like, right
Yeah.
now? But so many
Yeah.
patients, Jelena, were traveling from other states and other countries to get treated there.
Oh,
That
wow.
also made me really grateful that for
Yes.
me, it was just a car
Yes.
ride away, right? It was a
Right.
totally different experience.
Right.
I didn't have to worry about booking a hotel or being out of
Yeah.
town or not knowing the
Hmm.
language. There was one woman who was on her phone and
Right.
she was on FaceTime, and it's because she needed her family member to translate what they were
Oh,
saying.
wow. Yes.
Yeah,
Yeah.
so there are a lot of challenges for people. But yes, MD
Right.
Anderson is in Houston. It's in the medical center and it's
Right.
really conveniently located. And so when I got there, then they wanted to do a lot more testing. They wanted to confirm
Yes.
that the pathology was correct from
Right.
the outpatient center that I'd had
Right.
the mammogram at.
Right.
So they also were really surprised because of the size of the tumor. They thought it would have spread. So there was a lot
Right.
of follow-up testing. Like I had a lot of ultrasounds done on both my
Mhm.
arms to see if there's any lymph node
Mhm.
spread. And then they did a full
Yes.
chest MRI,
Right.
chest x-rays. They wanted to see had it spread into the bone, has it
Mhm.
gone into the lungs.
Yes.
They were really worried about metastasis
Mhm.
because for
Mhm.
their calculations there was a 90% chance I should have had a mets. And again,
Mhm.
I chalk it up to my mom and my dad's prayers and everybody else's
Yes.
prayers that
Yes.
I was I was a medical anomaly because I had bilateral invasive ductal carcinoma at 36, but I was also
Yeah.
a medical anomaly that I
Because
really only had a 10% chance of it not spreading. And alhamdulillah, I met
yes.
that applied to
Mhm.
me.
Yeah. Yeah. I'm so
Yeah.
glad you mentioned that part. Yeah. That sometimes what you're told and what actually happens can be very different. And we should always kind of hold on to that sense of hope and belief in possibilities.
I
Um,
agree. I also know that when I got back from performing Ziyarat of Imam Hussein, I
right.
got really good news that initially they told me that my left side was stage 2 and my right side was stage 1. But
Yeah.
when I came back from Ziyarat the second trip, the physician assistant who is there for my oncologist said, actually, we're seeing that you're really a stage 1B on the
Oh,
left after our final pathology, and they had done some other, I don't know what it was based off of. And so I didn't believe her, and I was like, I actually want to talk to my oncologist directly,
yes.
please. So then she set up a
Yes.
call with her, and
Yeah.
she was like, no, it's true. Like we went back and looked at some data, and you are actually a stage 1 on both sides. And
Yeah.
that was, I really feel like a gift, right? That was a gift of
Right.
Shifa,
Yeah.
because the
Absolutely.
prognostic, how they calculate the percentages of like what your
Yes.
longevity could look like.
Yes.
So
Yes.
stage 1 is always a better longevity than a stage
But
2 versus stage
the best
3 and
scenario.
4.
Yeah.
Yeah,
Absolutely.
it really
Yeah.
was, alhamdulillah. So there were a lot of glimmers in the middle of, a dark
Mhm.
time. There's
Mhm.
always room for light, and sometimes you have to be patient. You don't always get those answers right away, but that doesn't
Right.
mean that you lose that persistence in
Right.
trying. Your job is to try.
Yes.
Your job is the process.
Yes. And I'm glad you used that word glimmers because I think it's looking for that light, even when you're in the darkest pit or when you're in a dark hole of despair and being told it's this size and it's this risk and recurrence and your age makes it more of a factor. I think it's looking for those glimmers. And even as I'm listening to you talk, I can't help but hear how you're noticing everything. You're noticing the staff and how they were compassionate. You're noticing how grateful you were to be able to be treated at this center, and I think that's something that I feel helps when somebody is going through a situation like this is to find those glimmers because there always are. Sometimes it's really hard and you have to look really hard, but there are always are glimmers. So now take me through what treatment you actually had.
Okay, so that was also surprising to me. And I think that's funny. We were talking about, I mean, we've talked about that even as healthcare providers, you don't realize until you're a patient yourself
Big
what
time.
that is like
Oh
and
my
how many
goodness.
options there are. I didn't realize how many
Yes.
options there were for treatment, and that
Right.
everything,
Yes.
I know it's protocol based, but that protocol is individualized and it's based
Right.
on again, if there's any level of spread into the lymph nodes, that is when I believe they would have you do chemotherapy first.
Right.
And that was actually why, that was one of the reasons they kept testing me for another week as soon as I
Mhm.
got into MD Anderson. I went to
Right.
they have multiple facilities in Houston. So we had to travel
Right.
to like the one in Katy, and wherever
Right.
the radiologist was like urgently available, that's where I was for like a
Yes.
week. And
Yes.
the conclusion was actually because we can't detect any spread because it's localized, the
Right.
treatment will start with mastectomy,
Right.
so with
Mhm.
surgery.
Right.
And so the idea was like if we can completely get rid of it anatomically, then
Mhm.
what we'll do
Mhm.
is we'll send the samples for the final pathology, and
Right.
they have what they call an oncotype score. And so the
Right.
oncotype score is what determines the risk of recurrence or metastasis,
Right.
distally,
Yes.
distal metastasis after a period of time. So my scores, alhamdulillah, again,
Mm-hmm.
bilaterally were very low.
Mm-hmm.
So then the protocol dictated that the next step would be that we can eliminate chemo and go
Right.
straight to, I qualified for left side radiation.
Okay. Mm-hmm.
And so left side radiation, I needed 30 rounds. And again, that was because there's different
Mm-hmm.
types of staging. So that was also
Right.
new. I thought it was, the
Yes.
prognostic staging is across the board. So that
Right.
level, stage 2 and stage 1 I was telling you about earlier, that's the prognostic
Yeah.
staging. And then they had anatomic staging. So anatomically, my right-sided tumor was like microscopic. It was like a
Yeah.
millimeter or something. But the
Right.
left side was 9 centimeters of total tumorous masses. So that was an
Yeah.
anatomic staging of 3.
Yeah.
So because of that size, that made me qualified for the radiation because,
Yeah.
and then they did detect one on final pathology. I had one micrometastasis in my left side to the lymph node that was closest to the
Mm-hmm.
breast. So,
Mm-hmm.
but thankfully, the next subsequent 3 lymph nodes were clear.
Mm-hmm.
So they were like, okay, the prediction of,
Mm-hmm.
any like further lymph node invasion would be really, really low. I mean,
Right.
it goes
Yeah.
in succession. So that's a good thing.
Yeah.
So they
Yeah.
were like, as long as we do the radiation, we feel like we would eliminate any
Yes.
metastasis that could be in your lymph nodes that was
Right.
undetectable.
Okay.
So we did that. So I had surgery in June. I recovered in
Yeah.
July and August. I started
Yeah.
radiation in September. I ended that in
Yeah.
October. And then
Yeah.
in November, I started taking the hormone blocker, tamoxifen.
Right. Mm-hmm.
My cancers were, and I guess this is like the third thing that is unusual or different for every breast
Yes.
cancer. It can be different, right? You can have triple
Right.
negative, triple
Yes.
positive.
Yes.
So you
Yeah.
have the receptors. So mine was estrogen and progesterone receptor positive and HER2
Right.
negative.
Right.
So
Okay.
that made me qualified for like hormone blocking agents,
Yeah.
especially because I'm pre-menopause.
Right.
And so they will determine at the 5-year mark if I should take it for 10 years. But
Right.
currently I'm on my 4th year.
Okay. So as I was listening to you, like a couple of things came across my mind. Number one is like even though you're in the healthcare field, as I was, did you experience a lot of like new learning during this journey?
Absolutely. The entire
Yeah,
thing
because
was
because
like, felt
even
like it
as
was
you're going
new.
through the terms, I'm like, what it must have been like for you back then to go and learn all this, be exposed to all this, even though you were in the medical field. That's one thing
Oh, what
I,
did it
I
feel like? It
yeah,
felt, it actually, in some ways, kept me really calm because I like
right,
learning and I like the
right,
education piece. So I
okay,
found it really fascinating. And I was also, I think my doctors enjoyed my questions. Like they didn't
right,
mind, right?
yes,
Because if you
okay.
remember when you did that Gallup,
Strengths test, yes,
yes, one of mine
yes,
is
just
context
learn them.
and learning.
Context, oh yeah, for sure, and learner,
So
definitely, yes,
I'm
yes,
like, hold on a second. Like, I need to understand this. Like, this needs to make sense, right? Because I'm not going
yes,
to do all these horrible things to my body if
right,
they don't make sense and if they're not,
right,
evidence
yeah,
based. And I'm really trying to
yes,
understand where you guys are coming up with this stuff because
right,
this is
yeah,
wild. Like, where's my port? Like, where's my chemo? I don't
absolutely,
understand. And how come I have to have like double mastectomies? Like, that's really aggressive. And then
right, yes,
are you sure you want to do the radiation after that surgery? Because like, ouch,
yes,
like you just
yes,
operated on
yeah,
that area and now you're burning
right,
the same
yes,
areas. Like this is horrible. So
right,
all of it, Shalina, had to make sense. And even now, that's why,
yes,
like, if I really, because it's a university-based institution too. It's a learning-based institution, so they're
yes,
affiliated with like University of Texas, and
right,
they're a research facility, so they have a
right,
lot of mid-level practitioners, like a lot of
right,
nurse,
mm-hmm,
what are they, nurse practitioners and like physician
mm-hmm,
assistants, and they're
mm-hmm,
awesome.
mm-hmm,
But if I really want like a deep dive, and I'm like, I
mm-hmm,
insist that I speak
mm-hmm,
to the MD that's in, the head of
yes,
my team,
yes, yeah,
then they're able to provide that. And so I feel like it's a really good facility because a lot of the people you're seeing are professors. And so they're used
right,
to explaining things from
yes,
scratch. And I'm like, teach me like a
right,
student. Like I want to know because
yes,
otherwise, like you can't. I'm not going to go with just what you're saying. And as you know, from
Right.
the beginning of this process, I had to
Right.
advocate, right? I had to say, I looked
Absolutely.
up these symptoms and they're not normal.
Yes. Yeah.
And, I'm coming to you with evidence that something needs to be done. And so I
Yes.
need you
Yeah.
to support me in
Mhm.
both directions, right? I'll
Right.
tell you exactly what I'm going through. You also
Right.
tell me like what I need to do and
Right.
why I need to do it. And then, we can get on
Yes.
the same page.
Yeah. And I think as a patient, it's so important to remember your role in this whole process, in this whole journey, that the patient plays an active role with leveraging their life experience, with their training, right? And in terms of you having a healthcare background, being a pharmacist, and your strengths, being a learner, wanting to know more, wanting to make sense of it, and being okay with bringing all this forward with you on the journey. I feel like that's a strong way of helping you cope and helping you not only cope actually, but helping you um like transform the whole experience for the better. Would you agree?
Absolutely.
Yeah, yeah. And I feel sometimes a lot of people are hesitant, but I always encourage people who are going through any kind of, you know, health disease to advocate and to ask questions and not to shy away from that. So tell me what helped you during your treatment and after? What is something that helped you, or a couple of things that helped you?
I think it was multiple things. I think because I was a mother of young kids and it was
Mhm,
COVID time, we really leaned on our families
mhm.
to be our village, right? And
Right.
my parents, came and stayed with us for a long period of time and really supported me. And my in-laws live pretty close by, so my kids spent time with, my husband's parents, my husband's sister's family. And then when my kids, we were looking at the school year starting. So I was going through this when my middle child was supposed to be starting kindergarten, which is a big thing, right? For a little
Yeah, of
girl who
course.
has
Yeah.
been pulled out of preschool and now is starting
Yes.
school. And then our eldest daughter was supposed to be starting fifth grade. And so that's when we looked into Islamic school.
Okay.
Um, Thankfully, the school that we have here called Al Hadi, they were
Mhm,
very supportive, very
mhm,
understanding. My husband
mhm,
called the principal, and he
mhm.
helped facilitate the process, the registrar, and we happen to know all of these people socially, but from a professional
Yes.
standpoint, they really helped us
Right.
out in getting our kids situated to the school and gave accommodations. So
Right.
because I was starting, and we did not know at the time we were registering them in the summer, we didn't know if I would need chemo and then radiation, or we could
Right.
skip chemo because chemo was going to
Right.
be a long process. It was going to be four
Right.
months or something.
Mhm,
So that was really going to create an
mhm.
immunocompromised household. And,
Yes.
I know that there are exceptions even in the public school system here where if
Yeah.
you have an immunocompromised parent or family
Right.
member, you can get accommodations,
Okay.
but at that time during COVID, we lived in a state, Texas, where unfortunately our governor did not support wearing masks in school.
Really?
But Al
Okay.
Hadi did. Thankfully, their
Okay.
leadership supported,
Okay.
a scientific approach and,
Right.
even
Yes.
an Islamic approach, right? Not to infringe upon the
Right.
rights of others. They
Yes.
respected that.
Absolutely. Yes.
So our girls started Al Hadi and they were wearing masks. And then because I started radiation and they said you will be immunocompromised for about 2 months, they did the majority of like, I think the first quarter at home. And so
Okay.
again, my mom and my sister-in-law really helped me
Mhm,
with that process.
mhm, mhm.
Thankfully, my sister-in-law is like a decade older than me, so she's very experienced with her own kids. She also worked at the
Right.
school for a while, and so
Yeah.
she's very
Yeah.
familiar with systems and very
Right.
savvy. So, they set up like a whole little school area in our
Yes.
dining room, and
Yeah.
she helped me acclimate to that system. And
Mhm.
so again, like it wasn't just one thing, right? I have both moms cooking for us. I have moms and my sister came and visited, for like a week, entertained the kids. I mean, there was a lot of effort
Mhm.
on the family's
Mhm.
part to do this.
Right.
And then on top of that, I myself, Shalina, knew that I was going through a tough time. Like it was not an
Mhm.
easy thing. So I was in counseling.
Mhm.
I even saw the psychiatrist at MD Anderson
Yeah.
once or twice
Mhm.
because I
Mhm.
wanted to talk about, post surgically, like what I was going through was hard. And
Of
that was
course.
something that I think is what I continued, for a long time, right? I did the
Right.
counseling for like 2 or 3 years.
Right.
It wasn't
Yeah.
like a couple of sessions and you're done.
Right. Yeah. Yeah.
And so that's also when I discovered you. And I
Mm.
knew, because Alhamdulillah, my counselor, life coach is, our family coach is it's a male psychologist who is
Mhm.
also an imam or like a Malana.
Mhm.
So he's, an alim, and he has a really strong clinical background. His name is Dr. Sayed Hadi Yassin.
Mhm.
And he's out in
Mhm.
California, and he helped me a lot
Mhm.
through postpartum anxiety and depression, as well
Right.
as when I first got
Yeah.
diagnosed with cancer.
Right.
I really wanted like the spiritual aspect too, because again, when you're
Mhm.
first told you have cancer, you don't know what that means. That could
Yeah.
mean something not
Anything.
so terrible, yeah, or it could mean
Yes.
death, on the other
Yes.
extreme.
Yeah.
So if death was on the horizon, like I knew I had
Right.
to prepare, and my dad was really, really good about steering me in his direction
Right.
multiple
Yeah.
times. And so
Mhm.
alhamdulillah, that worked out really well from that angle. But then I think when I knew I needed to speak to a woman who,
Mhm.
preferably who had experienced it or understood cancer specifically. And so
Right.
you were
Yeah.
alhamdulillah an answer to those duas, because
Yeah. Alhamdulillah.
you understood all of it, right? You understood
Mhm.
the anxiety as a mother,
Mhm.
the hardship, as a mother, and
Yes.
as a patient. You
Right.
also understood like the fear of, losing a parent to it. And I think
Yes.
from top to bottom, like you just understood all of it. Plus you had been
Yeah.
trained by the institution. And so you
Right.
knew how to,
Yes. Yeah.
approach it through like in a methodical sense that
Right.
also is
Yeah.
really important. Like again, when you're teaching
Right.
someone and when you're coaching
Yeah.
them,
Yeah.
specifically about cancer, I think there
Right.
is a lot, because you're handling the physical aspect, but also the emotional and mental aspects.
Absolutely. Yeah.
So
And yeah, and I'm so grateful that we met as well. And I love how when I asked you the question, what helped you during your treatment and after, you gave a very holistic response. You addressed the physical and practical help you received from family, right? The cooking, the coming to stay with you, the helping with childcare. You addressed the mental and emotional things that you had to do for yourself, whether it was counseling or coaching, and then the social support as well from family. I also feel that you even addressed like the spiritual aspects of recognizing that cancer affects your whole self. And a lot of times people just think it's okay, you get through the treatment and you're back to normal. And I think the one thing people know who have gone through cancer that that's not true at all. Despite what we want it to be, it's not. Cancer, the impact of cancer continues after your treatment is immediately done and that danger is over. And you need to continue to provide support for yourself in terms of physical support, social support, mental, emotional, and spiritual. And I think, again, like I said at the beginning of our talk, is I appreciated that about you in our first conversation, that you are open to support, you are open to counseling, even earlier before we met. And that takes a certain mindset. Um, so what can you describe one challenge or a challenge that comes to mind that you had during your journey, during treatment or after?
I think it's what you're saying. Survivorship
Yeah,
is really tough. And I know it's hard for everybody around you. Like I know
yeah,
cancer itself takes so long to treat.
right.
It's not a one and done surgery. It's literally months of treatments and follow ups. And
Mhm.
I felt like, I tell people I feel like I spent like half my summer because,
Yes,
after surgery, I needed so much physical therapy. I used to have
right,
like sometimes 3 sessions a week.
right,
And so I felt like we were going to the hospital at least 3 times a week. Radiation was
right,
5 times a week for 6 weeks, right? Plus
right.
follow ups,
Yes, yes,
plus like the pre-radiation visits where they're calculating your dosage and they're
yes,
making you do
absolutely.
all the whatever they
Yeah,
do, like cast, or like they
yeah,
measure everything. So there were a lot of appointments and it was exhausting. And again, between my husband and my dad, I think, and my my own self, I was able to drive for part of them.
mhm,
Thankfully we were local, so we were able to manage,
mhm,
but it was a lot. And there comes
mhm.
a point where I think for everyone, even the people you live with, there's only so much they can take and do,
Yeah,
right? I mean,
yeah,
they burn out too. And so
right.
everybody's burned
Yeah,
out by the end of the
yes,
acute treatment. But
right.
then the next phase starts where you feel really
Yes,
alone.
right.
You feel like
Yes.
you've already been, and that's the problem, right? You don't want to feel like a burden, which is why you have to get that mental help
Yeah.
because feeling like a burden is not a good thing, right?
Right.
My
Yeah.
counselor used to tell me that, my coach, Hadi Yasin, Sayed Hadi would say, like, don't use the word burden because
Mm,
that's not a good word. Like that is where
yeah.
you lead to a lot of deep depression, and
Right.
that's not
Yeah.
that's like a symptom of someone who is depressed. So
Mm,
you didn't choose to have this, and they
right.
have their own tests, right? Everybody around you
Yes.
is
Yeah.
experiencing their own test from God, and to see how
Yeah.
they respond to this as well.
Right. Yeah.
And so it is just a part of life that we all
Mm,
have to face and
so
see that,
true.
how we handle it.
Yeah. Yeah.
But I think what ends up happening is because you have like those effects that remain, especially I always tell people, like, I can tell because even though I had a double mastectomy, I had radiation only on the left side, and my left
Yeah.
side is very different than my right side.
Right.
The skin, the muscle, everything has changed in a
Mm,
challenging way. So,
right.
um, and because I had a toddler and she needed to be picked up
Right.
regularly and
Yes.
she hadn't even been potty trained. When I met you, she
Yes.
was a little one and
Yes.
she would sometimes sit next to me, right? And I would try to distract her
Yes. Yeah.
while
Yeah.
I'm
Yeah.
talking to you. And so that was really, really hard to be separated from her and to physically be challenged while trying to be a good
Yes.
mom was,
Yeah.
I would probably say, one of the single biggest challenges of my life.
Mm, yeah. It is. I appreciate you sharing that. Yeah. And so what do you think helped you in that time? Survivorship is a challenge people don't often talk about. And then also looking after your young one, because your older girls, even though they were still young, you could kind of converse with them. But that young one was so little. And I know strongly about your beliefs about being an active, involved mother. So what helped you during this time?
So one thing that was really important was, again, continuous counseling, communicating
Yeah.
with my husband.
Yeah.
He had to be like mother and father a lot of times, and
Hmm.
he really helped. I mean, when he would be there, my sister always jokes that our youngest is like his little queen. She was
Yeah.
queen bee, and he just,
Mhm.
he's happy. He puts her on that pedestal, and
Yeah.
he recognized it. So when he was there, that used to really help me. But during the daytime, we would just I would try to. I kind of learned with her, right? And she was smart. I mean, even though she was a
Yeah.
toddler, she
Yes.
was 14 months old when I got diagnosed. And
Yeah.
that summer, so she was what, 16 months old. I had a mastectomy pillow. She would run to me with it and
Yeah.
not sit next to, because I had trained her almost that, like, if you're going to sit
Yeah.
next to me, then like you have to be really careful and I have to use a pillow.
Yes.
And she would
Yes.
bring me the pillow.
Yeah.
And, the
Yeah.
physical therapist was like, okay, we're going to work with this specific issue that you're
Yeah.
having,
Yeah.
right? Because it's
Yeah.
related to caregiving.
Yeah.
So they kind of taught me, they're like, okay, sit on the floor with her and
Hmm.
play with her on her level. Don't
Hmm.
try to pick her up. And so
Hmm.
it was almost like this challenge where, like, I had to learn how to parent without picking her up more than
Right.
needed,
Yes.
which is like
Yeah.
way easier said than done. And I'm
Yeah.
actually still, I'm still working on that, Shalina. I actually
Yeah.
now have one thing that I've done recently is like rejoined the gym, thank God, and gotten a trainer because there's that
Yes.
study, right, that's showing like 150 minutes of
Absolutely.
exercise per week
Absolutely.
prevents further cancer, any cancer.
Yeah.
So I'm
Yeah.
trying to do that. So that was actually something that, I told the trainer, like, I really need your help in
Hmm.
building upper body strength
Yeah.
again and,
Yes. Yeah.
addressing the
Absolutely.
idea that as a mom, I have to be able
Right.
to lift things, right? And I have to be able
Yes.
to
Yeah.
be functional. And so can
Right.
you please help me
Yes.
like with this
Yes.
specifically?
Yeah, absolutely. But I think also, Alien, I'm just going to spell it out because I think it comes back to you being open to do things differently. And I think a lot about what cancer showed me, and I think what I've heard in other women is how we have to let go of old ways that or old beliefs that we think are the only way. And so, even though you parented your first and second daughter a certain way, I feel like you had to learn to be open to parenting your youngest daughter a different way, being open to accepting help, being open to play differently with her, being open to caring her differently, so as to not to impact your physical recovery. And I feel like the more we allow ourselves to be open to doing things differently and seeing things differently, the better it is in our recovery. Um, and I feel like you have carried that with you, beginning, during, and after. It doesn't make it less easy. I do recognize that. And I do also appreciate the fact that you mentioned how the aftermath of cancer doesn't leave us. We are always left with wondering about what we can do, what's under our control to minimize our risk of recurrence. Um, so because I brought up recurrence, maybe we can just talk briefly on fear of recurrence is something everybody who's gone through cancer will face, whether they admit it or not. Um, and I guess my question to you is, how do you navigate through fear of recurrence?
Sometimes it'll catch me off guard. Like I'll have a perfectly
Yeah,
normal
yeah.
week. I won't even think
Mhm.
about it. And then suddenly you hear about, because if you're in support groups,
Right.
somebody will just throw it out
Yeah.
there, like in a post that,
Yes.
I
Yeah.
was doing fine and out of the blue, I have a lung mets or I have a bone
Mhm.
mets.
Yeah.
And I was just having some really bad, back pain or like some rib
Mhm.
pain, and it
Mhm.
turned out to be a mets. And so
Right.
that's the problem. I
Yeah.
think that it's one of those things where, and then, other people will be like, well, I was perfectly fine the 5 years or the 10 years I was on hormone
Mhm.
blockers. And then the
Mhm.
year I got off of them is the year I got diagnosed with
Yes.
a
Yes.
recurrence.
Yeah.
Which actually I feel like is the only reason I even take it, because at this point I'm like, well, the oncotype scores were low, and
Yeah.
I took the
Yeah.
most aggressive approach when it came to surgery,
Right.
so I really should be fine. But whenever I read things like that, I'm like, oh God, like, I need to follow through with whatever they're telling me to do.
Right.
Because again, it's
Right.
evidence based, right? I mean,
Right.
these are based off of
Mhm.
statistical calculations.
Yeah.
I feel like at some point you also stop fighting it and you accept it, that
Mhm.
if it happens, then it happens. And
Mhm.
at that point, you'll handle it the way you did the first time. And if it
Yeah.
doesn't work out, then it was your time to go. I think
Mhm.
accepting death as a reality, and that
Mhm.
all of us can die from various things, right? It's not just cancer. I mean,
Yeah.
we are, the absolute in life is that we're going to die, but
Right. That's the
dying of
known.
this
That's
specifically, is what we're trying to prevent, literally.
right. Yes.
And it's not just, mortality, right? It's also morbidity.
Mhm.
So it's like what we're talking
Yes.
about. Like when you look at studies, they don't just look at death outcomes. It's not
Right.
just about dying. It's
Yes.
also about
Yeah.
life, quality of life, and what we're describing, that
Yes.
like sometimes the side
Yes.
effects of these treatments are really, really severe.
Right.
So how much can one body take or should take, right, in
Right.
order to stay alive? It's
Yes.
not just about
Yeah.
staying alive. So um, I think for a mom, and we talked about this as well, by the grace of God, your son got married. I'm so happy for you.
Mhm. Thank you.
And like, that's my prayer, right? That you get to
Yeah.
witness your other
Yes.
children's
Yes.
happiness, and that I get
Yes.
to witness mine. And that's the goal
Yes.
on
Yeah.
earth.
Yeah.
Um,
Right.
you know,
And so, yeah, so it's always balancing your sense of hope with fear. And I think as I heard you speak, it's like you can't ignore that fear, right? I think a lot of us have grown up like thinking, oh, let's not acknowledge it. But it's acknowledging that fear, knowing that that's part of a cancer journey, and kind of being open to saying, well, and you said, well, let me just face death. If that's what's coming up for you, is facing that, our own mortality, and having conversations with ourselves about it. But we can't ignore the fear. We've got to acknowledge it and develop ways to balance that sense of hope. And what's your why? What's your why? And for both of us, it was our children, doing whatever we can, to live to see them grow up, inshallah. So let me ask you, what is one piece of advice you have for some person going through cancer right now? What would you tell her if she was going through cancer right now?
I would say to utilize all the resources possible. And that includes this, right? Conversing with another person
Yeah.
that's gone through it is extremely powerful and important. Don't be afraid to ask for help. You're
Right.
not a burden, and
Right.
you didn't do anything, specifically to bring this on to you
Yeah.
or your family.
Yeah.
And again, rely on the power of God and seek intercession specifically from
Mhm.
Imam Hussein al Islam.
Hmm.
um, if
Beautiful.
that's, the faith that they're following,
Right.
that
Yeah.
you have other means too. It's not just about protocols and medications and treatments.
Right.
It's also
Yeah.
true healing lies in the power of love and God, and
Hmm.
that's the design of the universe. So,
Hmm.
um, channel whatever spiritual side that you believe
Hmm.
in and
Hmm.
rely on that as well, right?
Hmm.
And I guess in a really simplistic way, I think even people who don't believe in like a religion, a lot of times will tell you they
Hmm.
believe in karma. So
Yeah.
do
Yeah.
good, right? While
There
you
is a
while you're
greater
alive,
power.
do as much good as you can, and it will come
Yes.
back to you and your family
Yes.
in a variety of ways. And the only thing you can do when you're going through a tough time is to be patient.
Yeah, that's such an important piece of advice is be patient because I feel like we all carry a sense of urgency of knowing the right answer now, of seeing the impact right now. And being patient is such a powerful piece of advice and reminder for all of us. Let me ask you, what is one piece of advice you would give to someone who is supporting someone who is going through cancer?
Um, I would say get help if you also need it. If you're the spouse or if you're the child or you are
Mhm.
for children, it's hard. They need an advocate a lot of times. But for other adults,
Mhm.
right, family members,
Yes,
don't be afraid to say that this is really hard and you're not
yes,
expected to know how to do everything, right? It's not
right.
fair. And there is an unfair, again, not burden, but there's an
Yes,
unfair amount that's placed on you sometimes if you're the spouse or the caregiver.
right. Yes,
And so you also need help. You need breaks.
yes.
And it's okay to
Mhm.
say, like, I need breaks, or I can't do this, or this is really hard for
Mhm.
me, and I need a professional to guide me
Yes.
through this as well. I think my husband and I doing, counseling with Sayed Hadi Yassin was an
Mhm.
imperative part of my recovery and
Right.
continued
Yeah.
survivorship, that
Right.
we have to find that balance, right? Like
Absolutely.
what are the expectations? What
Mhm.
norms have changed, in our
Right.
marriage and in our household?
Yes.
As
Absolutely.
parents, like we need guidance on how to navigate anything our kids are going through as a result of
Yes.
this specifically. I mean, even in general, parenting is really hard, but I think
It
because
is.
we've gone through this on top of everything else, that parents
Yes.
face, we know that we had
Absolutely.
to ask for help and guidance,
Yes.
and we're open to that guidance.
Yes.
And my husband is too, which is unusual. I mean, he was born in the U.S., but still, like for a person of our culture and background,
Mhm.
I think there are a lot of men that don't want to say that they
Yes.
get help, and thank God he's
Yes.
not like that. And even though he's
Yes.
very, I mean, I'm a lot more of like an extroverted, open book, and he's an
Yes.
introvert, and he doesn't
Yes.
share as quickly as I do, but he is
Yeah.
supportive of me sharing. He's supportive of,
Right.
like
Yeah.
I've done a podcast and
Yes.
I've
Yes.
done, an interview even like
Mm.
with the school, and that's a
Right.
pretty big community level audience. And
Right.
even though he's
Yes.
so private himself, he's like,
Yes.
it's your story. And if that helps you and you
Yes.
feel like you're helping other people, please share it.
Yes. Yes. And I think, I think my husband's the same way in terms of he's an introvert as well, although some people won't believe that. But he also came to an understanding that this is my story, and what he can do best is to help me um, heal with the way that I feel that healing is helping me. So really want to thank you for coming and sharing your experiences. Do you have any last words that you want the viewers to know about cancer, about, anything at all related to this journey?
That I want to thank a lot of the people on my, if we're going to post this on Instagram, they have
Yeah.
been really supportive. A lot of friends. I mentioned, our immediate families, but my extended family was very supportive. My
Mhm.
friends were from all over, right? Not, I mean, Houston, and I grew up
Yes.
in the Dallas community. A
Right.
lot of people from Dallas, a lot of people from Michigan, where my family
Mhm.
members live, other
Mhm.
countries. My cousin that lives the furthest away from me geographically is my cousin Masma in Malaysia.
Yeah.
and just from everywhere, India, England, you name it. I mean, I can't even give an exhaustive list. My really
Yes.
close cousin Batul's in Montreal in Canada,
Yes.
and despite being so far away, I remember my cousin Gulsum in Michigan. She was one of the first people that found out, and she
Mhm.
and Batul sent me flowers when I had my biopsy, and they just said, "We're
Mhm.
praying for you." And
Right.
my sister
Yeah.
is in Dallas, and she got me a survivor bracelet
Right.
before I even knew what was happening, and I started crying, and I was like,
Wow.
"What if I'm not a survivor?" And she was like, "I think you're gonna be."
Yeah.
So, playing that
Yeah.
role in somebody's life,
Yes.
they'll never forget it as long as they live.
Yeah, I think that's a beautiful way to end is all these people who are so dear to you, but they really showed how much they care for you and how they will continue to support you despite them living far. And I feel just as a takeaway for everyone, I think it's never underestimate the impact you have with a kind word, with a kind gesture. And it's not about asking detailed questions to the person who's going through cancer. It's just showing that you care, right? And
Hmm.
that goes a long way. So again, Aeliya, I really want to thank you for sharing so openly and honestly. And we will continue to keep in touch. And I really want to encourage you to continue sharing your story and spreading the word because you are a real advocate to everybody who's going through this. So thank you.
Thank you for everything that you do, and I really appreciate the work that you do, Shalina. It's can only pray that you get the reward you deserve, both in this
Inshallah.
world and the hereafter.
Inshallah. Thank you.
Thank you. Hafiz.